I am truly delighted to have the opportunity to talk to you today about turning policy and evidenced programmes into better outcomes for children. And I was reflecting as I walked over here that I'm delighted in more than one way, because there's a bit of circle of life moment going on for me personally. My mum was she was a student here at Homerton College. She did her teacher training here, and she's not with us today, but I'm sure she would be very pleased to know that I'm back in a place which made her very happy and was the foundations for her teaching career. You'll have gathered from what Jenny said that I'm not an academic. I'm not going to pretend to be an academic, and I'm not going to try and talk about the science of implementation. But what I really want to try and do today is to bring in some reflections about implementation based on very sort of practical experience, as Jenny said, from Stoke, the Midlands, and from the North East too. We've got programmes now in Redcar and Middlesbrough, and I hope not a spoiler, but we hope to be in Scotland very soon. So just a little bit about Thrive at 5. We are on our way to being a national charity. We are a national charity, and we're working in communities that face particular hardship. If you can get it to work in Stoke, you can probably get it to work in many other places where communities really struggle. And what we're doing is that we are bringing local communities, families and partners together to strengthen the early years system. There's a lot of great stuff out there. Also that children can thrive from pregnancy to 5, and so that parents and carers can play their role, that critical role on that journey. We all start at the moment from a position of strength, and that's thanks to a lot of the work that goes on here by many of you, because we've got a really strong body of evidence. So our foundations are strong. We know what matters. We're learning more about what matters to improve outcomes. And at this moment in time, we're also living and working in an environment where there are lots of well-intentioned policies and guidance, which is directing us and advising, among other things, that we must use evidence-based programmes. And there's a really high government ambition at the moment. Whether you like the measure or not, there is a high government ambition for 75% of children to reach a good level of development in the next couple of years. But turning that policy and all of that evidence into better outcomes, into actually implementing well, is very, very hard. That won't come as a surprise to you, but that absolutely is our experience wherever we work. It takes careful thought, it takes experimentation, it takes innovation. And it was great to see the boards out there. There's a lot of that innovative thinking going on. So I'm just going to focus on 4 themes today. Big themes, all of them. I'm going to start firstly with fixing data problems. I'm going to talk secondly about finding resources. Where are those resources to deliver programmes well? I'll move on to improving language and communication with adults. And I'll finish by talking about building relationships as the foundations for change. But I hope you'll bear with me as I just take a moment to get us thinking about, well, why is it that we need to implement well? Why are we even having this discussion? Why have you invited me to speak today? The fact is that all that well-intentioned policy, all of that guidance can't change the outcomes of children. It doesn't do it. It doesn't do it in and of itself. Let's just take the recently published guidance on Best Start family hubs and healthy babies. It's set out over 79 pages. But what it does is it sets the requirement, just the requirement. It doesn't tell us how to do it. Put it this way. It's like us all having a recipe for a meal, which takes no account of what ingredients we have, how many diners we're trying to feed, how many chefs are at hand, or whether they've got the right equipment. because improving outcomes really depends on what is delivered and what is deliverable. And I don't need to say this to you, I'm sure, but getting this right matters especially for those children whose lives are and will continue to be, whatever we do, affected by systemic challenges and long-standing inequalities. Because for those children, what we're trying to do is to overcome wicked and really entrenched problems. Just wanted us to look at the scale of the problem. On the top line, we've got the all children good level of development measures from 2022 through to last year. And we see that upward trajectory to 1.1%, an increase in the number of children, the percentage of children who are reaching a good level of development. But let's look at those children who are eligible for free school meals. There's actually been a decline in the number of children who are reaching a good level of development at their entry into school, from 51.5% in 2022-23 to 51.3% in 2024-2025. And in some of those places where Thrive at 5 are working, only 40%, and sometimes less, children on free school meals are reaching a good level of development. For some of our children, therefore, actually quite a few of them, we are heading in the wrong direction. Correcting course is going to require us and everybody out there to build bridges, to bridge that implementation gap and to walk what are really hard yards of delivery. So let me bring us on to data problems. The Best Start Family Hub guidance sets out the requirement for what data should be collected, used, and analysed. In fact, data has a starring role in the guidance. It's got something like 80 mentions. And let's just compare that to the number of mentions of children, 115. Data 18, 80, children 115. I'm actually going to say that emphasis is justified because intelligent use of data and high-quality data to inform our ways of working is likely to improve the quality of what we do. But here's the reality. Many local early years systems, and certainly the ones that we're working in, are a long way from achieving that government expectation. And I can give you a flavour of the sorts of problems that we're seeing. First of all, there is a pervading fear of sharing data, even when data sharing agreements are in place. That fear stems, we think, because of a lack of understanding and sometimes a lack of confidence in GDPR rules. It stems too, we think, from a concern that data doesn't tell us a good story. Because sometimes that data tells us that we aren't, in fact, reaching parents, or that we just don't know how many parents and children we are seeing and affecting. And there's that worry that if we were to tell the truth, that funding might be cut. And I want to pause there because this is a fundamental problem. If we have a system where we don't encourage the sharing of data, whatever it shows, we can't improve services for children. We kid ourselves that we are doing the right things, delivering the right evidence programs, when in fact parents and children aren't receiving the right level of support, the dosage that the evidence says will make that critical difference. The second problem. The existing infrastructure makes data sharing, frankly, really hard. Different systems used across health, public health, education, nurseries, schools. We all use data in different ways. We hold our data in different places. And those different places and systems, they don't speak to each other. Sometimes not easily, and sometimes they just don't speak to each other at all. I think it takes a data wizard to join and integrate those systems. And third, linked to that last point, when did you last find a data wizard or many data wizards in local early years systems. We just don't have access to those people. So let's be realistic. We're not going to overcome all of these problems overnight. And my own sense of it is that radical improvement will ultimately take central government intervention. But let's not despair, because in the meantime, there are some really great examples out there of local early years systems in which data are being shared and used to good effect without an all singing and dancing integrated data solution. And my point here is that data is so important that we can't allow perfection to be the enemy of the good. We can't allow it to be the enemy of an adequate workaround. So let's talk about some of those workarounds. Let's start with the problem. We're in a family hub, local authority staff, and we're asking ourselves, how do I know when a baby has been born on my patch? How do I get access to the parent contact details, the parent's contact details for that child? I don't have that information. I'm sitting here in my family hub. That information sits with the birth registrar. It might sit with GPs. It might sit with a health visitor. It might sit with the midwife, but it's not with me. And when I don't have that information, when it's not shared with me, what do? I fly blind. I put programs out there, but I have no idea whether I'm reaching the right people or anybody. And the truth is that some family hub staff, and it's not their fault, they are flying blind. And so the workarounds. In one place, and this is beautifully simple, what's happened is the family hubs have asked GP practices to use their text services. They've asked the GPs to text out to new mums and pregnant mums and to text on behalf of the family hub. Connections are therefore being made without any data sharing at all. Beautifully simple. In other places, what we've seen is the sharing of data within a local authority, so between the birth registrar and with the family hub staff. So that is data sharing, but it's proved to be a bit easier than sharing with health. So another good and relatively easy workaround, but I'd just ask you to bear this in mind, that there are birth registrars who feel there is no legitimate interest in sharing data, and they don't. And so what happens is that really critical birth data sits entirely uselessly in one bit of the local authority and isn't transferred across. And then there's a third workaround, and this is super simple. And this is a workaround that we can all use where we have good relationships. Because relationships can sometimes overcome seemingly intractable data problems. I'm going to tell you a bit of a story here about a midwife. It's a midwife in Stoke, and she was trying to help Jodie. Jodie, who had experienced really severe depression after the birth of her first child. But that depression, that experience of depression, wasn't so severe that she met the threshold for specialist support. And so Jodie struggled alone with her first baby. Happily, by the time Jodie was pregnant the second time, something had changed in the local system. And that was that new relationships had been forged. The midwife knew the local parent champions. In Stoke, we call them parent connectors, but they're the same thing. And Jodie plucked up the courage. She agreed to be connected with a parent connector. And that parent connector encouraged Jodie to come to the family hub. And she ended up being a regular attendee at a session called Babbling Babies. Jodie now speaks really passionately about the difference that made for her. She didn't struggle with her mental health, and she observed, having been to Babbling Babies, that she had a bond, that really critical bond with her second child. So let's think about that. That parent connector didn't have access to data about Jodie. She couldn't reach out to her, she didn't have any contact details, but it was that relationship between the parent connector and the midwife that made all the difference. Human connection can succeed where infrastructure fails us. Now let's consider another data conundrum. How do we best know which children need our support? And equally important, when we deliver that support, how do we know that support is making a difference? How do we do all of that measurement? Well, part of the answer obviously lies in the selection of the right measurement tools. And I'm not talking here about the ages and stages questionnaire. And I'm really encouraged, as I'm sure we all are, by the places that are supplementing the ages and stages questionnaire with tools like ELIM and welcome screening. This ought to be the practice everywhere, because the choice of those measurement tools really matters. But that is just the start, because we need an appropriately skilled workforce to use those tools, and once they've used those tools, then to have the skills to deliver the right evidenced programme. But here's the rub. I'm sure you're all looking at me and saying, well, where is that extra workforce? The workforce is already stretched to the limit, don't we know it? I'm sorry, I haven't come here with a magic wand. I'm not going to conjure up solutions to recruitment and retention. But I do have a few reflections about alternative ways that we can think about resource. Because tight budgets require us to consider how we can do the same or even better with less. In practice, I think what this means is that we need to carefully select and invest in and stick with just a few of the right evidenced programs, not too many. I'm slightly overwhelmed with, in a good way, by all the evidence programs that come out, but it's about careful selection. It also means using data, back to that, are we using the right data tools, to choose those few things that acting in combination, because it's all about, there aren't any silver bullets here, it's about how we combine things, can make a real difference to outcomes. Put it this way, it's about identifying best bets, it's not about spreading our bets. Let me take us back to Stoke. There they've made a decision to invest in a health visitor. And she's being deployed for the sole purpose of collecting additional information. And she's collecting information not just about early language and communication, but about parent mental health, the sort of information that may not be accessible from the health system, from other parts of the health system, but information about parental mental health, parent-infant relationships, how often is that collected, and home learning environments. What she's doing is that she's going in alongside the health visitor in the family hub, who's collecting data as part of regular mandated checks. And what she's trying to do is she's trying to capitalise on really high attendance rate for those regular checks. In Stoke, we've got about 90% of our parents who come to their checks. If we can leverage that to gather more data, great. And what we've seen is, in fact, 60% of the parents who turn up have been willing to engage in more checks. Not a bad take-up rate, but what we're doing is to flip the checks. So far we've been doing them after the mandated checks, and now we're going to see what happens if we take those measurements before the mandated checks. Perhaps the take-up will increase. Let's see. But all of that is an example of making a smart choice. A decision to invest in a skilled health visitor to support better data collection. And if we get this right in Stoke, it will help us understand what support is needed, and it will help us understand whether any of that support is making a difference. We'll know whether we're making the best bets. My next story is about how do we draw on the capacity, the capability of a whole community. So this is a story about doing more with less cash. It's a story about using volunteers and about sharing teachers. Let me take you back to September 2021. 5 at 5 were new on the ground in Stoke, and we were all emerging from the COVID pandemic. And teachers told us in Stoke, as they were telling everybody, that there had been a marked increase in the number of children with significant developmental delays. Many more than usual had few words, many had no words. So we started a conversation about the tools that we should use in that moment and in the future to resolve that problem. And I was particularly interested to know whether the Nuffield Early Language Intervention, NELI, might help. NELI is, after all, one of the best evidenced oral language interventions on the market, and government funds the training in NELI. But interestingly, the teachers in Stoke weren't convinced that NELI was the answer. The problem, they said, was one of capacity. While they recognised, as I've said, that many of their children needed help, they simply didn't have the resource to deliver 20 weeks of an intervention, 20 weeks which included a lot of small group work. There just weren't sufficient staff to balance whole class teaching with NELI sessions, and none of the schools could afford to recruit more teachers. We came up with a solution, and it's now being tested and refined over the past 3 years, and it's been benefiting 7 schools across 6 different academy trusts. The solution involved training student volunteers from the University of Staffordshire. Look what you could do here, whole university of students. I'm not saying it's easy. It's certainly been a journey to understand how to recruit students to stick the course of volunteering. It's a big ask. We've had to learn about how to allow students access to classrooms. We've had to learn about how to manage 20 students across seven different schools. I mean, it's difficult stuff. But the point is this: those students proved that they could deliver NELI effectively. That felt huge. It's been a really low-cost solution that has benefited many reception classes now, and also the students themselves. Some of those students now want to become early years teachers, so a bit of a solution to the recruitment problem, but all in all, a win-win. The schools have also experimented with sharing other resources, and again, the idea is quite a simple one. So these are schools that are used to sharing sports staff, they're used to sharing music staff and drama staff, so why not share an early years teacher? And that's what's happened. So across those 7 schools, they've been experimenting with sharing 2 higher level training teaching assistants. And what those teaching assistants have been doing is using the measurement tools, so back to using measurement tools really well. They've been overseeing the delivery of NELI by the students that I've just mentioned, and they've been providing additional capacity to deliver other programs. They don't have the distraction of monitoring lunch queues or of going out and staffing the playground. And so for the past 3 years, every child that has needed additional early language support has received it. And last year, 97% of the children who received that support saw improvements. I think it makes the point. I'm going to move us on from data into language and communication with adults, because early years strategies depend on how we work together, and therefore how we talk to each other, whether we communicate with each other. I'm not, in the time I've got today, going to try and talk about discussions and conversations and communication between professionals, although I'd say there's too little of it. We don't often have time for it. But what I do want to talk about is communication with parents. Let's just go back to the Best Start Family Hub's guidance and what it says. It says, we should publish offers in multiple languages, and we should not use medicalised language. And then there are some other top-line suggestions. Use varied digital touchpoints, whatever that means. But that's about it, because policy guidance just can't cover anything. Let's just reflect that there is a whole expert specialism out there called communications. Behavioural science is another separate discipline. But we can't get away with excusing ourselves with the lack of access to those disciplines or that expertise, because the key thing is to think really hard about how we reach parents effectively. If we don't reach them, we can't support them. And back to one of my data points, we need to be honest about which parents we are, in fact, reaching. Experience at Thrive at 5 has shown us that the channels of communication that we use and the words we choose, if selected well, can nudge people and parents in the right direction. Communications with parents should always be shaped by their channels and the words they themselves use. The experts in communication are parents. A short anecdote, I hope, will help. Back we go to Stoke. We set up a Facebook page there because that's where parents said they would go. We asked about WhatsApp, we asked about all sorts of things, but they said no, Facebook. The channel's been run by a local parent. She has communications training. The timing of posts is run according to a content calendar with different moments carved out to talk, for example, about infant mental health. Well, that's happening this week. Sometimes it's about play, International Day of Play, and getting ready for school. So everything's curated and sent out at the right time. The language she uses is really carefully tested and refined. And our communications officer has worked with celebrities. It's what we use in a lot of other communications. We use celebrities to try and raise the profile of the things we want to talk about. And the last time she tried it, she had 40,000 hits. Who was the celebrity? The local vicar. Turned out he was a bit of a hero. Who knew? Anyway, determined to do more, and being very proud of the reach of her Facebook page, we wondered whether we could use it to advertise a new evidence programme that we were about to launch in Stoke. It was PEEP Learning Together. I'm sure you've heard of it. So off she went. She posted. We turned up to the session. 2 parents. Parents who we had expected to turn up said they simply didn't understand what we were talking about. What's PEEP? So she tried again. This time she marketed this amazing opportunity as learning together. No reference to PEEP. It made absolutely no difference. Why? We asked the parents, test, learn, refine. Parents said, we don't want to learn together. Fair enough. So she tried again. This time, she said, come and make finger puppets. Come and make finger puppets. And do you know what happened? 21 parents turned up, and dads were there too. They made finger puppets, we didn't lie. But without knowing, they were actually attending a structured PEEP Learning Together session. They didn't need to know, they didn't want to know that they were signing up for an evidenced programs. So let's use the right words, let's brand things in the right way. It really makes a difference. And finally, I'm going to bring us on to relationships because these are an often underestimated ingredient, absolutely critical. Relationships don't actually get as many mentions as data in that guidance that I've been talking about. They're down to 44 mentions, not 80 or 115. But interestingly, they are called out, and quite rightly so, as an underlying principle for delivery. They have an elevated status. I would go further. Relationships are the vital golden thread of everything we do. And why do they matter? Because children and families benefit when there is ongoing cooperation and collaboration between everybody working in the early years system. When support and services are properly integrated. And all of that depends on good working relationships. Let's think about the consequence of a lack of connection and a lack of relationships. Well, one consequence can be that families are targeted multiple times. I'm going to tell you about the parent, and this was actually a parent. We're going to change geography. We're going to go to the northeast. This was a parent in Redcar. It's a bit of a sad story. She told us about receiving 9 letters from 9 different entities. She said she was so paralysed and so confused that she did nothing. She didn't respond to any of those letters. And at the other extreme, we've got parents with whom we have no connection at all. I talked earlier about the midwife and Jodie and the parent connector. We made a difference to Jodie's life through connection. Without that connection, let's take it from Jodie's perspective, she'd have had no support after the birth of her second child, and the chances are that she would have struggled with her mental health again, and she wouldn't have been able to bond with her second baby. She'd have struggled in just the way she did with her first. So relationships succeed where that data infrastructure fails. I'm not dissing infrastructure. It would obviously help if the right infrastructure was there for us to join hands, to work together. And I don't mean just data. We could do with much better governance systems that take us out of our silos, where public health, education, nurseries, schools all sit in different places not speaking to each other. We could do with a bit more infrastructure. But I don't think we need to overcomplicate. We shouldn't blame defects in infrastructure for the absence of relationships. Relationships don't require infrastructure. They are formed when we meet, as we are today, and spend time together. What we do need to do is to create opportunities for connection. And in the Midlands and the North East, we've really seen what can be achieved by just bringing people together from across sectors, from across different areas of practice. What we've done is simply to convene people in working groups, in seminars, at conferences. It's that physical in-person moment when we bond. It's all about carving out time and prioritising opportunities for human engagement. Last year, we brought about 150 people together in Redcar to talk about early language and communication. It was a conference. I was really surprised because for many in that room, it turned out it was the first time that they had met. These were practitioners all working in the same schools, the same nurseries, with the same families, but they hadn't met each other. Brilliantly, connections were made. New bonds were created. And off the back of that conference, the local authority now helps and arranges for nurseries and schools to come together. They have speed dating sessions so that nursery teachers can speak to reception teachers about the children. They need that human connection. They don't need data infrastructure. They just need to speak to each other and know each other. It was an easy and important win. a community leader in Stoke has really made me understand what this means. She talks about how new connections have really empowered her in what she does. She has this expression, and I might be showing my age and her age here, but she talks about having a Rolodex of business cards. She says that's how it feels. Let's imagine the contacts box in your iPhone, or it's the same thing, but she's connected. So she says she now knows who to call when she's trying to find support for a family that she can't support through her church. And even better than that, she says that she trusts the person at the end of the phone, or the person that she meets in the street, that she has met and be connected with, will truly take that baton and run with it. But the most important relationships of all are, of course, those relationships we have with parents. Which brings me on to the subject of trust. Because when parents don't trust the people who offer services to them, who offer support to them, they simply don't engage. Absent trust, the truth is that parents won't attend 10 weeks of parenting classes. They probably won't attend a single one. Let's just unpack a little bit why it is that there is a lack of trust. Because sometimes it's historical, it's not about what we're doing, it's something that's in the parent's own experience. They themselves might have been the subject of targeted help. They may feel judged. They may have struggled themselves at school, and they might just want to avoid educational professionals altogether. And also, let's just call it out. Years of underinvestment in universal early years services have left a legacy of distrust. Places that are now family hubs are remembered as the place where you go to see the social. Rebuilding trust, therefore, requires non-judgmental conversations. It requires services and support to go where parents are. We need to meet parents close to their homes. We need to meet them in and by the nursery. We need to meet them in the shops. In Redcar, there are now tens of stay and play sessions for parents and children run by voluntary groups in churches, mainly. These groups are so popular that that's where we know we will find parents. And they're more popular than some of the family hubs. It's just the way it is. So why would we sit and wait for those parents to step out of their comfort zone and come to us? We should get out of our comfort zones and meet parents where they are. Parent connectors, parent champions, known and trusted faces are really good at doing this, really good at going to where parents are, building those bridges. And in Redcar, the family hub staff teams have seen this and they're responding to it. And this is news just from yesterday from the team. The Redcar family hub team have decided that they are going to go and volunteer to run parent, baby, toddler groups in schools. Brilliant stuff. Rebuilding trust also means that we need to think really hard about services and support. Leaping in with the offer of a parenting program doesn't always cut it. A frazzled mum wants, first of all, support for her needs. We ran a survey in Stoke when we started work there, and what parents said to us was that they were lonely. They wanted a safe place to go. They just wanted to meet other parents. They wanted to find practical help. Fast forward to now, and the buzzing, and it is now buzzing, Bentley Family Hub isn't the place where you meet the social. It's the place where parents go for baby weigh-ins and health checks. It's the place where parents can find voluntary groups, like the Bread and Butter Van, like the Citizens Advice Money Advisors. In time, what we've seen is that as parents have become comfortable in that space, trust and relationships have grown. And various programs and interventions have been woven successfully into what's happening in that hub. But interestingly, when the hub staff tried to weave a structured program into Fun Friday, there was a bit of pushback, mainly from the dads. I haven't got it in for dads. It was the end of their busy working week. And they said Fun Fridays was supposed to be just that, please, fun. So we've left Fun Fridays alone. The bottom line, and I'll sum up here, is that implementation isn't easy. It's not straightforward. Delivering positive outcomes for children in their early years takes really hard work, not just from parents, but from us all. It means that we need to lift our heads out of all of that policy, all of the new guidance, not just around family hubs, around families first partnerships, around neighbourhood health. It's coming at us thick and fast. What will actually make that difference is putting our time and effort into relationships, into joining hands across sectors and with parents, and investing in really thoughtful and careful practice. Great implementation takes relentless patience, testing, learning, and improving all the time, and being prepared to innovate. At Thrive at 5, we and our partners have had just a little glimpse of what can be achieved. Last year, in Bentley and Abbey Holton, two of the communities we've worked in, the percentage of children eligible for free school meals didn't decline. Remember those figures from earlier? Didn't decline, in line with the national average. Do you know what happened? The percentage of children achieving GLD on free school meals went up by 11.4 percentage points. Something's happening. It's a really great and it's a really promising sign of change, but we can't rest on our laurels. It's 1 year of results and there's much more to do. So we shall continue to walk the hard yards of delivery, continuously learning and refining. Because, and this has become a bit of a motivational track for me, and please don't judge me, but it's a 1982 track by Funboy 3 and Bananarama. And do you know what the chorus says? It ain't what you do, it's the way that you do it, and that's how you get results. It's a bit infectious when you listen to it. Anyway, thank you very much for listening to me today, and I'm here for questions if we've got time.